After a good hand hygiene, sanitize your hand to avoid cross infection. Hi, my name is Mispha. Can I know your name and age, please?
My name is Jyoti, age 26.
Okay. Today I'm going to examine your cranial nerves, sensory, motor nerves, and deep tendon reflexes. Is it okay with you?
Okay.
Okay, thank you.
Cranial nerve 1 olfactory nerve test the sense of smell by presenting the patient with familiar non-irritating odors. First, be sure that each nasal passage is open by compressing one side of the nose and ask the patient to sniff through the other. Cranial nerve 2, that is optic nerve test for visual acuity.
Confrontation. I will place my hands before you and tell me when you are going to see my fingers. Can you see my fingers?
Yeah.
Okay. Good. The visual confrontation is perfect for my patient.
Examination of 3, 4, and 6 oculomotor, trochlear, and abducens. Test the extraocular movements in the 6 cardinal directions of gaze and look for loss of conjugate movements in any of the 6 directions, which causes diplopia. Ask the patient which direction makes the diplopia worse and inspect the eye closely for asymmetric deviation of movement. Determine if the diplopia is monocular or binocular by asking the patient to cover one eye or perform the cover-uncover test. Check convergence of the eyes. Identify any nystagmus. Ask the patient to fix his or her vision on a distant object and observe if the nystagmus increases or decreases. Examination of cranial number 5, trigeminal, and the motor function of the cranial nerve while palpating the temporal and masseter muscle. In turn, ask the patient to clench the teeth. Note the strength of the muscle contraction. And ask the patient to move the jaw side to side. Test for sensory function of cranial number 5. Test the forehead, cheeks, and jaw on each side for pain sensation. The patient's eye should be closed. Use a suitable sharp object, occasionally substituting the blunt end for the point as a stimulus. Ask the patient to report whether it is sharp or dull and to compare sides. If you find an abnormality, confirm it by testing temperature sensation. Take 2 test tubes, colder and warm one, dried before use. Touch the skin and ask the patient to identify hot or cold. Test for light touch using a fine wisp of cotton. Ask the patient to respond whenever you touch the skin. Test the corneal reflex. Ask the patient to look up away from you. Approach from the other side out of the patient's line of vision. Number 7, facial nerve. Inspect the face both at rest and during conversation with patient. Note any asymmetry and observe any tics or other abnormal movements. Raise both eyebrows, frown, close both eyes tightly so that you cannot open them. Show both upper and lower teeth. Smile, puff out both sides. Examination of cranial number 8, that is acoustic nerve. Assess hearing with the whispered voice test. If hearing loss is present, determine if the loss is conductive from impaired air through air transmission or sensory neuronal from damage to the cochlear branch of cranial number 8. Test for air conduction and bone conduction using Rene test and lateralization using the Weber test. Cranial nerve 9 and 10, that is glossopharyngeal and vagus nerve. Ask the patient to say or to earn as you watch the movement of the soft palate and the pharynx. Warn the patient that you are going to test the gag reflex, which consists of elevation of the tongue and soft palate and constriction of the pharyngeal muscles. Ask the patient to turn her head to each side against your hand. Observe the contraction of the opposite sternomastoid. Listen to the articulation of the patient's words. Inspect the patient's tongue as it lies on the floor of the mouth. Look for asymmetry, atrophy, or deviation from the midline. Ask the patient to move the tongue from side to side and note the symmetry.
My recordings for the cranial nerve examination, cranial nerve 1 to 12 are intact. Option.